Good afternoon, everyone, and welcome into our, I guess it's our continuing series on living a longer and healthier life. I'm Warren Pierce. Last month, remember, we talked about your heart. Today, with the help from our experts from St. John Providence Health System, we'll spend the next, 60 minutes or so observing Colon Cancer Awareness Month. And you should know that colorectal cancer is one of the most common forms of cancer in the United States, and as the second leading cause of cancer deaths in the country, it is also one of the most deadly. And over, 135,000, last number I checked, new cases are diagnosed each and every year. 56,000 or so die from it each and every year as well. But, and this is certainly what we want to discuss, if detected early, it is one of the most preventable and beatable forms of cancer. And joining us in our Webcast studios from St. John Providence Health System, the Director of Surgical Oncology and Peritoneal Malignancies and the program there in the Department of Surgery, Dr. Richard Berri. Good to have you with us today. In a very new, looks clean, just out of dry cleaning outfit there you have. And next to him, colon and rectal surgeon specializing in advanced colorectal surgical procedures, Dr. Amer Alame. And I guess we should start basically for the benefit of those who are not really familiar. And we should say at the outset, anyone watching this or online at WXYZ.com who is 50 or above, or knows someone, maybe a family member or a friend who's 50 above, you've got to listen to what is about to unfold before your very eyes and ears. But let's start with Dr. Berri. What and where is the colon, and what does it do?
First of all, thank you for having us.
Sure.
And we look forward to the hour, and we look forward to the discussion. We encourage anyone to call and email, and we're eager to answer your questions. The colon is an organ that is in the abdominal cavity, and it lays really in all quadrants of the abdomen, which make it one of the more unique organs in the abdomen. So it starts really in the right lower quadrant, and it goes through the abdomen, across the abdomen, down into the left lower side of the abdomen, and down towards the rectum, where it then turns into the anus.
All right, so wait, so this on this side over here, this would be the descending colon?
That's correct.
On this side, and then the transverse colon goes here.
Very good.
And then the ascending colon is over here?
That's correct.
And
so
right in the bottom is the appendix, right? Hanging out from the below.
Right.
Because you didn't bring the model, so I'm going to be the model today. So that's basically what we're talking about in this area.
That's a great description.
All right.
The function of the colon, and there are many, and some of, obviously, the transit of food and liquid goes from the mouth through the digestive system into the stomach, into the small intestine, and right where you mentioned where the appendix is
down over here, right?
Is an area where the small intestine, which is called the ileum in that area, enters into the right colon, or the ascending colon. And there's a valve in that area that controls the entry of liquid, stool, into the colon. It then enters the ascending colon and travels through the colon, where there are a number of things that happen physiologically, such as the absorption of water until stool is formed and passes through the left colon into the rectum and out of the anus.
And basically, we're talking here, Dr. Alame, that the colon is kind of cleansing the body. It's what is it? It's removing things that shouldn't be there.
The main job is really just solidifying the stool so that your body can retain the fluid which it still needs, and whatever waste material is left is what ends up in the rectum to be disposed of.
Colorectal cancer, cancer of the colon, cancer of the rectum, strike more women or men?
Well, both genders, Warren, are susceptible to colon cancer. The biggest risk factor for colon cancer is really just time. The older we get, the higher, our risk factors of developing colon cancer. Hence, the benefit of screening, starting at the age of 50 for anybody with no risk factors in their family or anything related to colon cancer in their family. 50 is really the defined age which somebody should get their first screening colonoscopy. Anybody else who has anybody in their family, like a first-degree family member who has had colon cancer before, the screening age basically goes to 10 years before that. So if somebody has a first-degree relative who was diagnosed at the age of 50, their screening date moves to 40, and so on for everybody else.
All right, and there are different tests that we'll get to. I had a colonoscopy about 3 or 4 weeks ago, and I brought pictures. We don't want to show them because it's dinner time, but I brought in my pictures of what happened with me, and we can talk a bit about that later on as well. But Dr. Berri, safe to say it's often a silent disease developing with not a whole lot of symptoms.
Yeah, I think as Dr. Alame mentioned, the benefit of having screening colonoscopies done is just that. Unfortunately, the colon and rectal tumors can develop from small polyps. And so until those reach a very large size, they don't really cause a lot of symptoms. So a patient or someone may have a small polyp that could be turning into cancer.
All right.
That really would not give us any symptoms. And so there would be no bleeding, no signs of a blockage of the intestine, until that polyp transforms into a tumor and becomes quite large, then causes symptoms of bleeding or blockage of the colon, and at that point the tumor is very advanced. And so you're correct. In the early stages, sometimes these tumors are not detected unless there is a screening colonoscopy or there is some symptom that would bring someone to a physician to investigate them.
Right. And Dr. Alame, the pictures that I showed you of my test showed, I don't know, I had 4 or 5 of these polyps that were there. And absolutely, I had no symptoms. I wasn't detecting anything, but there they were sitting, waiting to develop possibly into cancer.
Correct. And polyps, when they get of a size greater than 1 centimeter or 1.5 centimeters, the amount of blood loss that is caused by these polyps is not significant enough for a patient to see anything in the stool. Some tests like, a hemoccult test, which is a test that detects microscopic blood in the stool, may be positive from these small polyps, but it's still at a stage which could have been even observed earlier with screening colonoscopies and proper screening tests done.
Yeah, no doubt about that. And we want to remind you, you're online at WXYZ.com. You have questions for Dr. Berri, Dr. Alame. Feel free to text those to us, and we'll get you the answers. This is such a key test to be taking and a discussion to be having for both men and women age 50 and over. Or you can dial us directly as well at area code 248-356-0077. So we'll wait for your emails at WXYZ.com. You're already on there watching, or call us directly at 248-356-0077, and we'll put you in touch with the doctors. Dr. Berri, so there may not be any symptoms, but there can be symptoms. One of the two of you alluded to what? Blood in the stool, for example?
That's correct.
Sometimes not clearly seen, but that's got to be a symptom and something to be aware of.
Yeah, that can be a symptom. Anytime there's blood in the stool, we advise patients or anyone who notices that or sees blood in their stool or in the toilet bowl after having a bowel movement or even on the toilet paper, then they should be advised to follow up with their doctor and have further investigations. In addition to blockage of the stool, even things like weight loss and a change in their bowel habits can sometimes suggest there may be something wrong. So a narrowing of the stool, more frequent constipation, or even diarrhea, just a change in the bowel habits, and then sometimes even a blockage of the bowel obviously can cause symptoms that would bring someone to medical attention. So all those things are important to watch for, and they can happen really in any patient, even with a small tumor that can be growing and was not detected early on.
That tumor that may be growing, that polyp, and we'll get into what those are, how long would it take, I don't know if you can generalize or not, to develop into cancer?
The evolution of colon cancer starts in the inner lining of the colon. The lining of the colon, whenever it gets an outgrowth or a polyp, develops into a stage we call adenoma, which is basically abnormal growth of the lining of the colon. And polyps are basically the resemblance of, or the development of these polyps is basically this lining of the colon trying to become into cancer. And Warren, to answer your question, the timeline from when the colon has normal lining into a cancer is in many years. It's anywhere from the range of 5 to 10 years. And this is why repeat colonoscopies, whenever somebody gets a colonoscopy, sometimes the second colonoscopy screening that they should get after that is usually sometime in the range of 5 to 10 if the colonoscopy was normal.
My doctor wants to see me in 3 years, for example.
And the reason why is because of the number of polyps that we're seeing. So the after a patient undergoes a colonoscopy, depending on the findings, a recommendation is entered of when to have a repeat colonoscopy done. If the prep was bad and the physician was unable to see the lining, it may even be sooner than that. If somebody's had over 3 polyps or some polyps that are over a centimeter, like in the report you showed me, the recommendations by the Society of Gastroenterologists is for a repeat colonoscopy in 3 years. If you've had less polyps or a normal colonoscopy, the recommendation may be longer than that. So it's really patient to patient dependent on what are the findings seen on the initial colonoscopy when the repeat colonoscopy should be done. It's not a standardized time for everybody.
Right.
And you should add maybe to that, and Dr. Alame can comment, that time frame can change, as he mentioned earlier, based on the family history of the patient and in which degree relative a patient's family may or may not have had colon cancer. So those times will change, and the specifics maybe Dr. Alame can mention.
Correct. Patients with a high risk of developing colon cancer will have obviously a shorter window of screening than patients who have 0 risk factors, no family history or any prior problems of colon polyps or anything like that. Those patients will be on a longer screening time.
Yeah, and if you're just tuning in, we are talking about colorectal cancer because this is the awareness month that we're zeroing in on. Taking your questions at 248-356-0077, or you're on the website, WXYZ.com. You can text us as well, and we have a question coming in for Steve. Has an ulcerated colitis. White blood cells came down to 8 from 18. Hemoglobin dropped to 12, now related to cancer. Is there a possibility when he has a colonoscopy done that there is a chance of colon cancer? A grandmother, here we're talking about 2 background family history. Grandmother died from it, just had a sigmoscopy done, and what kind of a diet should this individual be on? So there's a lot to cover in that area as well. But getting back to the hemoglobin and the blood cells now related to cancer, is there a possibility?
Steve, I'll take this question
Sure.
for Steve. Steve, with ulcerative colitis, the risk of developing colon cancer is because of inflammation of the inner lining. Anytime we have inflammation of the colon wall, the risk of developing cancer is higher than a normal individual. The risk of developing cancer with ulcerative colitis is essentially time dependent and disease dependent. So if your ulcerative colitis is well controlled, hence the inflammation on the lining of the colon is controlled and you have no inflammation in the wall, your chances of developing cancer are lower. And if your disease is well controlled throughout your whole life, that's less of a chance than if you have flare-ups every now and then, or if you continuously, the management medically, your colon is continuously inflamed despite medical management. I don't see your age, Steve, on the message, but the older we get, any patient with ulcerative colitis has a high risk of developing colon cancer. This is why annually your GI physician will probably recommend for you to have a screening colonoscopy to, 1, make sure that the inflammation is well controlled, and 2, there are biopsies that are done of your colon at random intervals because of your risk to make sure there's no dysplastic areas. And what I mean by that, areas that have started to change from being normal into something cancerous. And
talking about,
about
the
diet,
yeah.
Steve, there are many studies done about diets with ulcerative colitis, and it's all over the ballpark. It's a hit or miss with many patients. There are many diets that are available out there that are considered an anti-inflammatory diet, but many of them you'll see that they work for one patient, they don't work well for another patient. It's really many times testing and trying which medicines cause a flare-up for you and things like of that sort. I would recommend maybe a dietitian, and we have dietitians at
Sure.
our office who see patients with ulcerative colitis. I'm sure your physician can also refer you to somebody maybe who can cover those with you maybe on a more detail.
Yeah, and we'll get into some of the
Yeah.
ways to prevent the polyps from growing, from colon cancer or a colorectal cancer from starting, smoking. We'll get into that as well. But your incoming questions at WXYZ.com, we'll take those, and your phone calls to 248-356-0077. Mira is emailing us right now. Can polyps be prevented? We're talking about my polyps that were there. These, what should we call them, mushroom-like growths
Yeah.
that line the colon. Can these polyps be prevented? Let's get Dr. Berri in with this one.
Yeah, whether or not they can be prevented is not very clear, and there's not any data to suggest that there's a measure that one can take that would prevent a polyp from forming.
How many did I have? Like 4 or 5?
I think at least 4.
Yeah, right. All right. So I had 4 there, and again, I didn't feel any discomfort. I didn't know, and the only way you could detect it is getting these tests.
Yeah.
But and how long do you figure they were growing there?
As Dr. Alame was saying, the transition from that growth until the polyp becomes detectable or noticeable and measurable can be years, and there's no clear timeline. But once they're present and seen and can be removed and measured, they've been there for a significant amount of time. The question goes on to ask about, can your diet affect the development of polyps, and can they be prevented?
Like red meat. If you're eating a big red meat eater, is that going to create some more polyps
Yeah,
in your colon?
Diet is extremely important, actually, in the presence of the potential of developing colon cancer, and there are specific recommendations that we talk about all the time. Maybe Dr. Alame can comment on those as well. But specifically with regards to diet, I'm not sure there's a diet that one would say could prevent the development of polyps. I don't know if you have anything to add.
Well, and these polyps, they almost, in looking at some of mine, they can, divide and then begin to reproduce at almost an unhealthy quickness,
Well,
possibly?
polyps, essentially, you see an outgrowth that is at a speed of growth different than the lining of the colon. And this is why, there's basically an outgrowth that is seen. Now, the speed as which it grows and all the other things, there are many factors, that come into play with this. And like I said, it takes many years for a polyp to finally convert and become a cancerous lesion. When a lesion turns into cancer or becomes malignant, then that speed becomes much higher in terms of growth, and then it has the potential of invading through the wall of the colon and spreading to other parts of the body, which is what hurts individuals.
Right, but Dr. Berri, when we talk to our viewers and those who are on WXYZ.com who are texting us questions about colorectal cancer, and we talk about this age 50, you've got to begin to get your test then. Is that to suggest the polyps haven't been growing typically with someone who doesn't have the background, the family history or anything like that? The polyps are beginning to grow after age 50? And that's why the tests then, among other things, have to start at that age?
Warren, I think that the recommended age of 50 is based on one of the points that we brought up early in the discussion about the development of colon cancer and polyps takes time.
Right.
And so one of the key risk factors is time and age. And so once we reach 50 or late 40s, the suspected time for the growth of polyps and the potential development of cancer is higher, just in general, than one would think in the 20s or 30s. And so to recommend a screening study in the United States, there has to be enough yield if we're going to do this. And so it wouldn't be wise to recommend it in the 20s or 30s, because the amount of disease we would detect would be low, unless there was a specific family history. And so at 50, if there were polyps that were developing for years, there would be a higher chance of detecting them at that age than if we started doing it at 30 or 40. But it's not to say that if somebody has symptoms or a family history or some of the things we talked about, they shouldn't be evaluated earlier, or if there's some other concern or symptom that's not clear.
And the question, too, from Mira was, can your diet affect the development of polyps? I have read that, among other things, smoking isn't good for anything, whether you're talking about heart disease or lung cancer. And I think lung cancer is a cancer that is the only other cancer that takes as many lives as colorectal cancer does. It's the second biggest killer in this country. But what about smoking? How detrimental is that? And how might that develop these polyps within the colon?
Well, Warren, smoking really is detrimental in terms of health and leads to development of cancers in multi-organ systems, not only just the colon. So any toxin that is introduced to the body can lead for this transformation of the lining of the colon to transform and become something abnormal. But smoking per se is not the only risk factor. Time is much of an even bigger risk factor of what we're talking here, but smoking as well plays a major role, not only for colon, for many other cancers as well. Diet-wise, to answer Mira's email, a high fiber diet basically retains toxins into a mesh and prevents contact with the lining of the walls of the colon, and this is what is basically theorized as the cause for a reduction in the amount of injury to the colonic wall with high fiber diets and fruits and vegetables and things of that sort.
How about lack of exercise, among other things, Dr. Berri?
I mean, lack of exercise in general. For,
obesity, too.
Obesity, lack of exercise, smoking, intake of, high intake of red meat, intake of alcohol, all of these things, and speaking from a surgical oncology perspective, and all the cancers that I treat, all of these things are risk factors for all of the GI cancers, in particularly the ones that we're talking about today, colon and rectal cancer. And so a diet that's high in fiber, as Dr. Alame mentioned, low in red meats, cessation of smoking, limiting alcohol intake, and a healthy lifestyle and a lot of exercise will clearly benefit patients and decrease the chance they may develop one of these GI malignancies.
Yeah. Some more incoming emails. You're at WXYZ.com. Feel free. This is such an important issue. Colorectal cancer. This is Colorectal Cancer Awareness Month as well, this month of March, as we talk with two doctors checking in with us, giving us the evaluation from St. John Providence Health System. Dr. Richard Berri and Dr. Amer Alame is with us as well, and so are you, with an email from Alice who says her mom died from colon cancer at age 63. She's in her mid-70s, has had small polyps in the last 2 colonoscopies, has a colonoscopy every 3 years. What's the percent of risk for cancer in the future because of her age, 75? Is there a point where you say, after you don't need these anymore, you don't need these tests?
Alice, if you keep getting your colonoscopies and whatever small polyps are found are removed, the chances of developing colon cancer is very low. And this is exactly the reason why screening colonoscopies are done and follow-up colonoscopies. It is for individuals, and say in your situation, they have a first-degree family member who unfortunately has passed from colon cancer, and now your risk factors, that adds to your risk factors of developing colon cancer. But as long as you stay up to date on your colonoscopies, the chance of you developing colon cancer is actually low. You may develop these polyps, but the difference between polyps and cancer is huge. When polyps are removed, you can pretty much forget about any chance of cancer from that polyp, since it has been completely removed.
Like mine were removed, but what about other polyps then growing elsewhere in this colon area?
Well, your physician has inspected all the colon,
right,
and whatever polyps he has seen, he has completely removed. Now, there is a what is called a miss rate with colonoscopies, and it's pretty low, maybe 4 or 5% of small polyps, like less than a few millimeters, can be missed with a colonoscopy. In your situation, Warren, if your physician has examined all the colon, like it sees in your report here, and he has removed all the polyps he has seen, so there are no other polyps in your colon that could potentially turn cancerous. And as long as you follow up in 3 years, like your physician recommended here with the colonoscopy, then the chances are pretty low. And if another polyp is seen, it is removed again at that time. And you see Bill has another email, and Bill is asking that if polyps are detected during a colonoscopy, how long should we wait before another exam? And we covered that briefly in the beginning of the interview, but we'll go through it over again now. There is no set or fixed time period that a patient will have to undergo a repeat colonoscopy. It all depends on your risk factors and why you underwent the colonoscopy. And number two, what is found during the colonoscopy. If it's completely normal and you have no risk factors, that time may be between 5 and 10 years for repeat colonoscopy. If polyps are found, depending on the number of polyps and the size of the polyp, a recommendation may be entered for a shorter interval, like in Warren's case, it is 3 years, and it could be even shorter if you add more things into the pot, like
maybe it's my family background,
or a poor prep where a physician was unable to see, or a flat polyp that was removed and another inspection has to be done specifically for that area. The repeat colonoscopy may be even as short as 3 to 6 months. If a flat polyp was removed in piecemeal, like in pieces, because the physician would like to inspect that area again. So the scope can be very wide, and it's taken on a patient-by-patient basis. The best thing you can do to know the answer to this question is, once your physician who has recommended that colonoscopy for you, he or she can tell you when is the next colonoscopy should be done.
Like mine said, 3 years.
Correct.
And if you're just tuning in, we're talking about this being the Colorectal Cancer Awareness Month of March. It is the second leading cause of death from cancer in the United States, and the third most common cancer overall. This year, more than 56,000 Americans will die from that, and more than 140,000 new cases will be diagnosed. And the information that I was reading, and Alice was saying she was in her mid-70s, the information I have, and you can correct this if it's wrong, doctors, but more women over the age of 75 die from colorectal cancer than from breast cancer. And 80 to 90 million Americans, that's what, 25% of the population of this country, are considered at risk because of age or other factors. But that statistic, more women over the age of 75 dying more from colorectal cancer than breast cancer.
Correct, Warren, and that's unfortunate. I guess the view of getting a colonoscopy is a little bit different than getting a mammogram, I would say. It's obviously regarded as like a more invasive procedure. Even though a colonoscopy is a very simple procedure, it does have some risks associated with it, but they're definitely not prohibitive to undergo a colonoscopy whenever it is needed. It is a same-day procedure, and many centers offer even screening colonoscopies on Saturdays for those patients who do not want to miss work. And to undergo a colonoscopy, many centers now even offer sedation that is under the observation of anesthesia staff, so a patient is completely asleep, like in our endoscopy center.
I was up, I was watching, I was looking at the TV camera right next to the bed. So I was watching some of that. But wait a second, we should mention here, in all honesty, having gone through this 3 weeks ago, that it's not necessarily this procedure that is what bothers most people. It's the preparation. It's cleaning out your colon. That for me began 20 hours before this procedure. Drinking liquids at one point 20 minutes for, I don't know, it seemed like 8 hours. Spending most of my time, or at least every 20 minutes, in the bathroom. Isn't that one of the major complaints that you get from people who say, okay, you need a colonoscopy?
Or I must say, you hit it right on the nose. People are more worried about the prep than the actual
right.
colonoscopy.
Maybe we shouldn't tell them.
Yeah.
Like, I don't think women tell other women about what it's like to give birth. Maybe we shouldn't be telling them before this particular procedure what you have to go through to prepare for it.
Or what I tell you, the day before the colonoscopy, and actually a few days before the colonoscopy, avoiding fibers and things that bulk the stool, like vegetables, may help cleanse the bowel better. And the skill of the endoscopist or a colorectal surgeon or whoever is performing your colonoscopy is limited by how much stool is left in the colon. I was looking at the pictures that you've had.
Yeah.
It is an excellent prep that you have had, and many times cleansing the bowel before a colonoscopy is probably the best thing you can do to help reduce the miss rate for polyps and things like that I was mentioning earlier. Because inspecting a clean wall, it is much better than having to wash, residual watery stool and things like that could hide polyps underneath. So, and it's if it's 1 day preparation.
Have you tried drinking liquids every 20 minutes? 10 I think it was 10 ounces a glass. Every 20 minutes. Have you doctors gone through that just to understand and relate to what your patients
Warren,
are going to experience?
To that, but if you have to do that once in 3 years to save your life, I would say
there's no doubt.
You should probably do it.
It is worth it. Sarah, let's get to Dr. Richard Berri, who's in with us as well. Sarah is emailing us, and feel free to do that right now before we run out of time. You're at WXYZ.com, so you can email us right now or call us directly at 248-356-0077. But back to Sarah, her colonoscopy showed numerous polyps. One of her grandparents also had a lot of polyps, but not sure what his diagnosis was. What does that mean, Dr. Berri?
Sarah's question about the number of polyps and numerous polyps is something that is quite relevant and that we see frequently. There are a number of genetic syndromes and familial syndromes where family members will have multiple polyps, and there's an entity that's called FAP, or familial adenomatous polyposis, where it's
easy for you to say.
It's a finding of numerous polyps throughout the colon. And
what are numerous?
And that's really the question. And
is it 5 or 6 like me, or
sometimes, Warren, you have levels of familial polyposis syndromes. FAP, the one Dr. Richard Berri is mentioning, if somebody goes over 100 polyps, I'm not sure if Sarah was mentioning something over 100. It says numerous.
Yeah, you're right.
Yeah, and sometimes an attenuated form of polyposis, FAP, attenuated familial adenomatous polyposis, could show only a few polyps scattered throughout the colon, like 20s or 30s, and those patients as well, like we mentioned earlier, they need screenings at shorter intervals to, remove these polyps, and should the need be, have any kind of intervention done for them.
And Sarah's doctor should, I would imagine, be able to discuss this with her as well, right?
Yeah.
All right. Frank emailing us as well, and don't forget, get your questions in. This is Colorectal Cancer Awareness Month. We're talking about anyone, age 50, men, women. If you're over 50, if you know somebody who is, it's very important that you get this information. But back to Frank, what new treatments exist for people with abdominal cancer?
Well, Warren, I can speak to this. This is, and I'm not exactly sure what Frank means with regards to abdominal cancers, but one of the programs that we've started at our hospital about a year ago, and that we do now as really the only center in the state, is we actually treat patients who've had colon cancer or rectal cancer that has spread to their abdominal cavity. And those patients, sometimes it's described as abdominal cancer, or as we mentioned earlier, tumors that have spread to the peritoneal cavity. We actually have a new surgical procedure that we use where we remove all those tumors from the abdominal cavity. We put in, instead of putting the chemotherapy into the vein, we put heated chemotherapy into the patient's abdomen, and it's called HIPEC, HIPEC, and it's something that we're doing now at St. John. And in the well-selected patient who has a colon or rectal cancer that is spread to the peritoneal cavity
Right.
or to the abdominal cavity, we remove those tumors, put in the heated chemotherapy, and follow them then in surveillance. And our efforts are that they will do better than patients who just got chemotherapy alone or may have not been offered any other treatments in those cases.
And Dee is emailing us as well. And don't forget, we're running out of time. This is a very important subject to touch on with the doctors from St. John Providence Health System, the Director of Surgical Oncology and Peritoneal Malignancies Program is here, Dr. Richard Berri. Next to me, we've got Dr. Amer Alame, who is specializing in advanced colorectal surgical procedures, minimally invasive as well. We'll get to that too before we're done. But back to Dee, who has heard that African Americans are at higher risk for mortality from colon cancer. Is this true? And should they have colonoscopies at maybe an earlier age, maybe not waiting till 50, 45 or 40 years of age? What do you think, doctor?
The recommendation for a screening colonoscopy does not change if you're African American or white. It is still 50 if you have no other risk factors. If you've just went and seen your family practitioner for your high blood pressure and it happens to be your 50th birthday and your primary care physician says happy birthday and here's your prescription for a screening colonoscopy as well with that. If you're African American or white, it does not change the age of screening. The risk of mortality does not have to do with the fact of being African American. It's just numbers change because of socioeconomic status sometimes and things like that. And access to care sometimes changes survival from colon cancer.
Not only that, Dr. Berri, but I have read where not only African Americans, but Hispanics as well are now more likely to be diagnosed with colorectal cancer in advanced stages. Incidence rates for colorectal cancer in these groups have been on the rise. I think colorectal cancer, from what I've read, has increased 46% among African American men and 10% among African American women as well.
Yeah, that's correct, Warren. And the reason is exactly what we just mentioned. In some groups in the country, there may be a lack of initial surveillance and routine follow-up because of whatever factors, socioeconomic or location or access to physicians. And unfortunately, in those cases, then people are detected at a later stage because they have not had the opportunity to have proper screening starting at the appropriate age. And we're actually looking at this specific fact at our cancer center now, looking at the incidence of colon cancer in Metro Detroit in African American males and females and trying to determine whether there is a difference. And that's something that we're looking at specifically to figure out if there is a difference just because of access to care or if there is some biological difference. But it seems, based on the data that we have so far and based on the national data, that it's more just a matter of access to care and being diagnosed later because there wasn't that screening. And so in any group, we encourage everyone, and if people don't have access to care, centers like ours, the cancer center that we are, we're willing really to see any patients, even if they don't have insurance or if there's some other factors that would limit them. We can help them at least get on the road to helping detect these things and get them the proper surveillance and the proper care.
And the age is 50. Keep that in mind as well. Another emailer here, Ed, wondering. Go ahead.
Sure.
Ed,
we'll take your question.
Right.
After a surgery, you're asking if you need to have polyps removed, how long is the recovery? Usually, Ed, polyps are removed during the colonoscopy through the endoscope. So when the scope is inserted, when a polyp is seen, an endoscopist or a colon surgeon will insert a snare or a grasper that would grasp that polyp and remove it. If the polyp is removed during your colonoscopy, your recovery is basically just from the anesthesia. You don't have any recovery or limitation to the recovery from removing that polyp. There are some rare cases where a polyp is so big that it cannot be removed with the scope. Those situations, will need a formal surgery to resect that area, and your recovery basically falls under the guidelines of recovering from a colon resection surgery. But if you've just had a screening colonoscopy and 2 or 3 polyps were removed, Warren, you'll tell us about your recovery after removing a few polyps.
Right, I wanted to drive, although they wouldn't let me drive. But I was ready to go. Yeah, the anesthesia wore off the little bit that I took, and no, you don't feel anything at all whatsoever.
And this is really why it's so important for screening. You're not going to feel polyps in your colon unless it's reached a size or became a cancer where it will be detrimental for your health. And Ed, the second part of your question says, if all is well and the polyps are removed, does one continue life as normal? And here's your proof.
Hey, here I am. Here I was just 3 weeks ago as well. So that's why it's so important to get the colonoscopy as well. And we want to talk too about other tests that are done. But if you're just tuning in, feel free to email us. You're at WXYZ.com. We've got the doctors in from St. John Providence Health System. Dr. Berri, Dr. Alame are here with us. They are experts when it comes to this particular subject. This is Colorectal Cancer Awareness Month as well. We've talked too about that magic number, the age of 50 or older. Almost equal risk for developing colon cancer for men and women. What is it about age 50, by the way, Dr. Berri, that begins to have the polyps develop or something going wrong? Is that just a natural age? Yeah. What's taking place in our bodies that's causing that at 50?
I think everyone is different, and it's not necessarily that at age 50 all of us have something that's changed or that's taken place that would then give us a higher chance of having a colon or rectal cancer. I think it's mainly because of the rate of development of polyps and the onset of polyps, and over time, the likelihood of developing a cancer gets higher. And so in the lifespan of an American or anyone in the country or world, the age of 50, I think, is a median age where the yield of performing screening colonoscopies will actually help us find those patients. And just as we talked about earlier, it's not necessarily the age has some physiological change, it's just the time frame that will change. And so if we start doing this earlier, our chance of detecting polyps or colon or rectal cancers, I think, would be much less and perhaps not needed.
Yeah, and for what we talked about, it almost sounds like these polyps that are developing that may or may not be cancerous. That's up for the doctor to determine after, for example, mine were pulled out and then they were de-analyzed, because they're so slow growing that you don't want to, over-test, doctor, or an earlier age before 50.
As any screening tool, health guidelines have to take into effect resources, for all the health system, so to speak. If we start screening everybody, like Dr. Richard Berri alluded to a couple of times, if we screen everybody at age 40, we will have so many colonoscopies that are normal that it doesn't make sense to screen people at the age of 40. And this comes to Rodney's question. And Rodney says, you're 46 and you've never had a colonoscopy, and a friend of yours was recently diagnosed with colon cancer. I don't know what the age of your friend is. It's missing from there, but it says, should you have one soon? In 4 years, you should have one. That's how 50. Soon you should have it. Now,
or is there a history? Maybe there's a history in his family, and then that changes.
Or unless Rodney's having some kind of symptoms or bleeding or some kind of abnormal change in his stool.
Losing weight is another symptom, isn't it, that you can't explain?
So, Rodney, if you've never had a family history, meaning none of your mom, dad, brothers, sisters, anybody in your family has had any colon problems, and if you've never had any symptoms, meaning any blood in the stool, any chronic fatigue or weakness or anemia or anything which has not been explained by anything else, then I would say there's no reason to get a colonoscopy. Now, if you have any of those, then you may have an argument of doing a screening colonoscopy sooner, since you're close to 50 anyway.
Well, and by the way, does it matter about diabetes? We're talking about what brings on these polyps. Gene is emailing us. Is diabetes a risk factor for colorectal cancer? And if it is, how come?
Yeah, the gene diabetes alone, there's been no proven link between having diabetes and developing colon cancer. Unfortunately, in patients who have diabetes, there can sometimes be, depending on the type of diabetes you have, a relationship with that and other diseases, and obesity and heart disease and high blood pressure and a diet maybe that is not high in fiber and higher in other things. So those things together If you put all that together, it could make you at a higher risk, but not necessarily that diabetes directly would give you a higher risk for colon cancer.
All right, let's take a phone call too, and you can feel free to dial us directly. We've got a few more minutes here with the doctors, 248-356-0077. Gwen, go ahead. You're on a direct phone line now with Dr. Berri and Dr. Alame. What was your question about colon rectal cancer in this awareness month? Can you hear us, Carol? You're going to have to turn down probably your whatever you're watching. Let me see. Do we have them set? Let me see here. Maybe not. Oh, there you go. Okay. Can you hear us, Gwen? Yeah.
Okay, I'm at my computer. Okay.
Yeah. You're getting confused. Yep.
Is that better?
It sounds like a Verizon commercial. Yeah, but go ahead. What was your question for the doctors, Gwen? Yeah. Can you hear us? Is the question.
Okay, I can't hear. So
No, can't hear us. Testing 1, 2, 3. Gwen.
I'll have to call back.
Yeah. All right. Call back because we can hear you loud and clear, and you can't hear us. No. The answer is no.
Hello?
Yeah, go ahead, Gwen.
And, no, she can't hear us. But Carol is emailing us. Maybe Gwen will try again. But Carol is emailing us. Carol's mother had and died from colon cancer. Has a celiac spruce
And colitis.
and colitis. What are her chances of getting colon cancer?
Carol, this goes back to a subject that we've covered a little bit earlier. We'll go over it quickly now as well. Colitis is basically inflammation of the lining of the colon, and inflammation of the wall, given enough time, can lead to abnormal changes in the wall that could then transform and become cancer. To answer your question about your chances of getting colon cancer, proper treatment and to make sure that the inflammation calms down in the colon helps prevent the development of colon cancer for any patient with colitis. Patients with colitis who are untreated and have colitis for an extended period of time, the longer the time goes, the higher the risk of developing cancer. And a colonoscopy, again, is a tool to evaluate colitis as well as any abnormal changes that have developed from chronic colitis.
And Dr. Berri, Dr. Alame talking about, again, and we have been talking mainly about these colonoscopies, but there are other tests too, like this, fecal occult blood test, to name one other test beside this one? What does that do? And how much of a recommendation, Dr. Berri, would you give for that?
Warren, the fecal occult blood testing is basically sampling the stool, and there are a number of ways that we can now give patients kits where they actually take them home and can sample their own stool and put it on what looks like almost like a card to evaluate whether or not there's a presence of blood in their stool.
Yeah, I got a couple of those from my doctor. I never sent them back for some reason.
Yeah, there are other, in addition to that, there are things that we haven't talked about with regards to colonoscopies, and we can talk about this briefly, and people may have heard about this. There are now what are called capsules that are used to actually look inside of the colon and bowel, and they're almost like a virtual colonoscopy that people may have heard of and may have had questions about.
How big is the capsule?
And the capsule is quite small, and
Does it have a camera in it?
it does.
Really?
And
So
those
you
images
swallow
are
it?
recorded and then reviewed, and maybe you can comment on the difference between that and a colonoscopy.
Well,
Sounds like science fiction stuff here.
new tests for screening include stool studies that measure some DNA material that is found in colon cancer cells. That's like the advanced version of a fecal occult blood test. Other tests that Dr. Berri was mentioning, one was the capsule endoscopy and one was the virtual colonoscopy. A virtual colonoscopy still includes a prep, but you don't have a scope looking through the colon. It's a CAT scan machine that then renders the images of what's inside the colon 3D. So
Yeah, but then if those pictures are taken and there are polyps there,
then you
you
have
still
to
have
have
to go. So why
exactly.
not
Correct.
kill two birds with one stone? I don't know.
I mean,
You can't feel it. I did it 3 weeks ago. So you're talking about maybe it's just the idea, the perception
Yeah, and again, there are many centers, including our center that does colonoscopies now under full sedation, monitored by an anesthesia person.
Right.
So you're completely asleep during the colonoscopy. Again, there are many other centers that do it with sedation, so that you're comfortable, like when you had yours, Warren, where you can actually watch
Yep.
the endoscopist go through the colon and see exactly what he's looking at.
Well, here's a quick question. If I had not had some anesthesia, and when the tube was inserted into me,
Correct.
would that be painful? What would it feel like
The
without any
And
anesthesia?
endoscopy without anesthesia, we usually try and limit it to short scopes, like a sigmoidoscope, which is a flexible scope that only examines the rectum and the last part of the colon. Because the further you go, the scope is a flexible tube, say as big as my pinky
there's a little
finger,
camera
and
at the end of
it's
it.
flexible.
Yeah.
The more bends it takes, the more uncomfortable it'll be for the patient if they're not sedated. So to undergo a full colonoscopy without sedation would probably be uncomfortable for a patient. And this is why it is rare to undergo a colonoscopy with zero sedation, a full colonoscopy. But sometimes shorter scopes, like I just said, a flexible sigmoidoscope, a shorter scope that examines the rectum and the last part of the colon, many times it's done without any sedation because it's short. But again, the more you have to cross throughout the colon, and like Dr. Berri was saying, the colon covers throughout all quadrants of the abdomen.
Right.
You have to make turns and turns until you reach the bottom right side of the abdomen again, where the colon starts. It would be uncomfortable to undergo the whole thing without any sedation.
Dr. Berri, why would you get a sigmoid that only went through the rectum in the first part of the colon? And would that be an earlier age?
Yeah, sometimes, Warren, in the past, especially a flexible sigmoidoscopy was used as a procedure that could be done maybe in the office and without a prep of the bowel that would give us a pretty limited examination of the colon. For someone perhaps who had a history of something in that area, in the anorectal area or sigmoid colon, that only needed an exam on a more frequent basis. But the key recommendations now, and I think Dr. Alame would agree, that starting at age 50, the most appropriate test, as we've said multiple times now,
Right.
would be to evaluate the whole colon.
Yeah,
Unless
in the
there is a
past-
specific reason only
Yeah.
to look at the sigmoid colon or to have a limited view of the colon.
In the old days, we had a skewed view, and we thought that colon cancer is more common on the left side. So in the old days, only sigmoidoscopes were being done to look at the left side. But then
Yeah,
we
that's
found
over here.
out
Was that I said the ascending colon?
the descending
The
colon
descending-
on the left and
Yeah.
the sigmoid.
And
And
the
then we
colon here
found
and-
out that we're missing just as many cancers on the right side by only looking at the left. So then the recommendation was done for doing a full or a complete colonoscopy.
All right, another incoming call. You can feel free. We've got a few minutes left here with the doctors from the St. John Providence Health System as we observe this colon rectal awareness month. And Diane is wondering, she got so weak during a prep last week.
Yeah.
Can I relate to that? Yeah, I probably could. Passed out, hit her head, ended up in ER with stitches and a concussion. When will the prep ever improve? It was supposed to be a new, easier prep. It seemed like this is a traditional prep that I went through, drinking that liquid, the 10 ounces, every 20 minutes. You're prepping for about 20 hours.
Diane, the number of preps available right now on the market for a colonoscopy is huge. It ranges anywhere from Go Lightly, a full gallon, which is 4 liters. You'd have a gallon this big, which you would reconstitute with Gatorade or any other, liquid or water. Other preps on the market have a smaller volume, down to maybe 2 liters, or even other preps include laxatives and tablets to help purge the system from all the stool.
I had Miralax and Ducalax
Yeah.
mixed into 64 ounces of Gatorade.
Correct. And the problem that Diane is alluding to is really a problem of physiology of the body. The way to cleanse the colon is you're given items that pull water from the body inside the colon, which is the colon's job is to do the opposite, actually, to pull the water in and back into the body, and you get all these preps that reverse that, and pull the water into the colon, thus flushing everything out. By pulling water out of the body, you get dehydrated, or you can have the tendency to get dehydrated. And this is why many patients mix their Go Lightly or whatever prep they're using with Gatorade or other energy drinks.
Yeah, that's what I did that.
Yeah, and you can drink after you're done with your prep. If you're done before a time which prohibits you from drinking anything before your procedure, you can drink any kind of clear liquids after that, including, say, any yellow-colored sports drink you want, a non-red colored sports drink, or water to stay hydrated.
No purple either. No purple.
Yeah. So staying hydrated during a prep, then maybe our listeners, Diane, would benefit from what you've just asked us, so that they can stay hydrated and prevent, having a lower blood pressure, which can cause you to pass out and have an unfortunate event like yours.
All right, here's Gwen. Gets a colonoscopy every year. No polyps, but said she had a spastic colon and atypical fail. What does that mean, and why is she getting a colonoscopy every year? Gwen is emailing us. I think she tried to call in before and couldn't hear us. So from the basis of that information, what do you glean from that, Dr. Berri?
I don't know if Gwen.
No polyps.
Yeah, I'm not sure how old Gwen is or why.
What's a spastic colon?
Or why she's getting a colonoscopy every year.
Does anybody know what a spastic colon is?
Spastic colon. I think there's times when the colon can.
Warren, I'm not sure
have
if.
spasms.
Gwen, I'm not sure if you have submitted the question with any typing error. Atypical fail. I've honestly never heard of anything related to the colon with that. I don't know if it's a typo or something like that. But again, a spastic colon, like Dr. Berri was mentioning right now, I mean, there could be conditions in the colon. I don't know if the...
No.
It's not something usually you can tell via colonoscopy.
Correct.
Right. As we begin to close out here, doctors, the statistic I saw recently suggested about 75% of all new cases of colorectal cancer occur in individuals with no risk factors for the disease other than being 50 years of age and older. And that's really what we've been talking about since we signed on and started talking about this almost an hour ago.
Yeah.
And there's an email actually in relation to that from one of our reviewers. Can colorectal cancer screening be a substitute for colonoscopy? Just to answer that, colonoscopy is the screening for colorectal cancer. Or do you still require a colonoscopy if you are over 50 years of age? There are other ways of screening that Warren has alluded to, the fecal occult blood testing, the virtual colonoscopy, and those other tests that we mentioned just a few minutes ago. A screening colonoscopy is still viewed as the gold standard right now because you can not only screen the colon, you can also intervene. Like in your case, Warren, when your physician saw the polyps, they were removed right there, then and there. If you were undergoing a virtual colonoscopy, let's say, if anything is found in the colon, you would have to undergo a colonoscopy to do that. The places where virtual colonoscopy can be a substitute. Say if somebody's had a colonoscopy the first time, had another one in 5 years, it's normal, had another one in 5 years, that's also normal. It's been normal for like 10 over years. That person may have the option of having a virtual colonoscopy to avoid having a scope, put through the colon. But the places offering that are still limited, even in the state of Michigan.
Dr. Berri, do you think it's too late by age of 50 to begin to eat a better diet containing vegetable-rich diets, maintaining a healthy weight, remaining active, those to try and prevent polyps from and colon rectal cancer from beginning?
Yeah, Warren, no, I think it's never too late to start that. And age 50, I think actually is, our patients are young at age 50. And so I would encourage everyone to follow that healthy lifestyle, maintain a diet that's high in fiber, low in fat, low in red meats, sustained from excessive alcohol intake, smoking cessation. All those things will help with any GI cancer. And we earlier talked about the incidence of colon cancer being so high in those who are 75 or older.
Yeah.
part of that is because as healthcare has improved, we are all living much longer. And so even if I'm 75 or 80, still following those guidelines, still perhaps getting screening colonoscopies will benefit us because we may live then even for another 10 years.
Bottom line here as we close out, the single best thing you can do to prevent colorectal cancer is to get a regular screening. If you have, more than one existing risk factor, or you are over the age of 50.
50.
Simple as that. Folks want to get in touch with the department over there, they just give you all a buzz?
Yep. Do you have the number for our?
Sure.
Okay, you can call our department at 313-647-3252 and speak with either Dr. Richard Berri or myself, Dr. Amer Alame. If you would like any advice or any opinion about anything, we're open to receiving any comments from you or phone calls or whatever you need if you want our opinion about anything.
313-647-3252 for the St. John Providence Health System and our two experts here this afternoon. Thanks for joining us.
Warren, thanks for having us.
And
Thank you, Warren.
I'm Warren Pierce. Thank you for watching, and good luck. Go out and get that screening.
Get your colonoscopy.